you ever wonder why so many diabetics have amputations? So do I. Today we've come to see Saskia, the podiatrist.
Good morning.
Good morning, Saskia.
How are you?
Good, thank you. How are you? Yes, that's a fancy name for foot doctor. Do you want to know the connection between these and diabetes? We are going to chat to Saskia, who will explain to us the importance of foot health to diabetics. So why do so many diabetics have infections in their feet?
If there's a wound under the foot, for whatever reason it is, or even an ingrowing toenail, what happens if the blood sugar is high? The bacteria in the wound, they like to move around fast.
Gangrenes.
They like high blood sugars, so therefore the wound can't close.
Ulcers. Holes in their feet.
If it's under the sole of your foot, you have constant pressure on it for walking, so it doesn't get a chance to heal. So what needs to be done, the pressure needs to be removed, either by an insole or whatever, something that I can make in the shoe to avoid pressure there. Now we're on the chair, so what I want to know now is I want to palpate, feel the bone structures of the foot, test the flexibility of the joints, and if it's anywhere painful or uncomfortable, you can just let me know. Sure. On this machine, I can see how you carry your weight on your feet. Besides that, I can also see the position of your ankles, whether one foot is going in or going out, and where there's extreme pressure, because there the colors, it's lighter. Your foot lights up because when you're standing, you close the veins in the skin, and that's why it appears in a lighter color. And where there's a brighter yellow color means there's more pressure. What I'm doing now, I'm checking the way she's walking. It's called a gait analysis. So what I want to see is how the heel contacts the floor and how the rest of the foot follows during the gait. Also, I can see here if there's more pressure on one side. If now you can walk on your toes back. So here I can see how the Achilles tendon is pulling up the heel. And when you turn around and walk back towards me on your heels. And if people have pain, I want to know if they're walking like this, if they feel the pain that they normally have, or not. Or people wash their feet, they think the water is okay, lukewarm. They only notice that it's hot because you get blisters in the skin transfer. The problem with diabetes is the fluctuation of the blood sugar level has an effect on the endings of the nerve. Now your feet are most far away from your heart. So if there's damage, nerve damage, it usually starts in the foot. Those nerve endings can be tested because it's not like the sensitivity is gone overnight. It goes quite gradually. If you don't feel any small things, items in your shoes, for example, that can be dangerous. If you don't notice that, and it won't heal because maybe of poor blood circulation. The test that we do is been done with a monofilament. It's a very tiny instrument. It gives us a little bit of pressure. If this cannot be felt, there's another one, which is much stronger.
Oh wow.
And that's that one.
Okay.
When I do the test, I'll ask the patient to close their eyes because otherwise they see it. But it's just important, if you're diabetic, to know whether you can feel this or not. At the end of the day, what we want to avoid is amputations, because that has a huge effect on the patient, but also in their financial life, in their family situation, economically. If you test your feet, the sensitivity, the nerve endings, on a regular basis, if there's nothing wrong, once a year. If you've ever had a wound, then you want to come more regular, because then you're prone to having another one.
And there you have it, folks. The importance of foot health to diabetes. Make sure you get your feet checked. Prevention is better than an amputation. Saskia will sort out any aches and pains that you do have. Her details are below. I hope you like this video. Please like at the bottom of the screen and subscribe to my channel. See you next time. Bye.